Hi, I'm Dr. Jenny. I'm a chiropractor who specializes in pregnant and postpartum women, and I really love to work on the rehab part and kind of the birth prep piece of pregnancy movements and postpartum movements. So this is my second video for my first trimester. We're going to work a little bit through some mobility exercises and then focusing a lot on like those outer glutes and our core. We want to make sure all of those muscles are still functioning well and staying activated throughout your pregnancy. So we're going to start on all fours. Actually, we're going to start in kind of a wide leg child's pose. So we're going to do nice wide legs so that your knees are on the outside of that mat. So a little bit wider than your traditional child's pose. And we're going to sit back and we're going to add a little bit of mobility in with our hips as we rotate forward into that cobra. So I call this pelvic rocks. These pelvic rocks. These are very helpful to work on that flexion extension piece of your pelvic mobility, as well as that little bit of rotation for your hips as you're coming back in through. So back and down, good, and then forward and through. Nice, and then back and down, and then forward and through. Really working on that rotation and a little bit of that mobility as you're working through that movement. Great. Next, I want you to put a band on. We're going to work a little bit of our outer glutes. We want to keep our outer glutes as stabilized as we can through your pregnancy, or as active and working as we can, because as your belly changes and grows, we find a lot of instability in, if you have unstable outer glutes, you tend to have a little bit more discomfort. And so we want to make sure that we're keeping those muscles as active as we can. So we're going to do a 3-side step, and then we're going to work on an air squat. So we're going to sit down and back, up and through. We really want to focus on pushing those knees out into that band. So really stretch that band, stretch that band. And then we're going to sit down and back, up and through. Good. Other way. 1 and 2. Good. Sit down and back, up and through. Step, step. Good. Down and up. So as you're stepping, you should feel a little bit in those outer glutes. Good. And then a little bit of pelvic mobility there. One more time. Step and step. Good. Down and up. Now, one of my favorite outer glute activation exercises, I call them V taps. So we're basically going to make a V. So we're going to step wide, wide, narrow, narrow, wide, wide, narrow, narrow. Switch your lead leg or do like 5, starting with my right side, and then 5, starting with my left side, because you get a little bit more activation with that first step. So you just want to keep that even, right? We always want to think about symmetry and balance when but definitely when we're pregnant, because that pelvic mobility really matters. So wide, wide, narrow, narrow. Good. Okay. Band can come off. So we're going to do one move for our inner legs here. So working on our inner legs helps also our core, our deep abs activate, which is also huge when you're pregnant. And so just kind of working on movements can help you as your pregnancy goes. So nice wide legs, as far apart as you feel comfortable. And we're going to sit over and up, over and up. So you should feel a nice stretch in those inner legs and that contraction as you're pulling up. Good. Over and up, over and up. So still thinking about that pelvic mobility, sitting those hips down and back, and then up and through. Good. Down and back, up and through. Down and back, up and through. Awesome. And then last one. You can use a weight if you want. First trimester, we're really just working on more mobility and focusing on specific muscles. But if you want to use a weight, you can, or a ball, or roll up a towel, whatever you have access to, even a pillow. But we're going to do some halos. So we're going to come from one hip, we're going to cross and go around our neck and over, and around and over, and around and over. Good. And around and over. So working on those low deep core muscles. Nice exhale as you come around. Inhale down. Exhale around. Inhale down. Good. Over and around. Good. Over and around. Working on those core muscles, keeping these low deep ones nice and activated. Again, we're not going to build you a six pack. We want to keep these muscles active and engaged throughout your pregnancy through different core exercises, again, to help create a little bit better stability and balance for the rest of your body as you progress through your pregnancy.